Ben and I both work in a local district general hospital, and we do quite a lot of simulation with our fifth-year medical students. But we found that research showed that as medical graduates, they weren't prepared for life as a foundation doctor. So basically, they needed more information about clinical reasoning, prescribing, emergency management, and handover. So we all know that Sim's a great learning tool, but it is guilty of shrinking time. So physiological changes happen faster than they normally would. Results are available immediately, and every patient has their own nurse. So during the meeting, we decided to see if we could address this situation and create a scenario that would portray a more accurate representation of life as a foundation doctor. So we came up with a front of house extended simulation, so over 3 days, pairs of students assumed the role of the foundation doctor. So they did an hour-long simulation in a 2-bedded emergency medical admissions unit, and we had volunteers who played the patients, and they were given pre-scripted scenarios. So one had chest sepsis and the other had acute pulmonary edema. So it involved, the students were allocated 1 patient each, and they had an hour to clerk that patient. They had to do a history and they had to do a relevant examination. They then decided what they were going to do for their treatment. So if they wanted bloods or cannulation or an ABG, the false arm would miraculously appear on the patient, and they would have to then communicate with the patient about what was expected, obtain consent, and then they'd actually have to carry out the procedure with the patient. We made them share one nurse, so that the nurse wasn't always available, so they had to wait for them for any investigations, and it kind of made that a little bit more realistic. They could communicate with each other throughout the scenario at any point, and we also gave them access to a medical registrar via a bleep so that they could contact them for advice. And then after the hour, any results that they requested were made available so that they could then collate their findings, and we made them present it to a consultant. So they came in and did a post-take ward round, and that was quite realistic. The consultant then debriefed the students afterwards. So we followed it up with a survey, and out of the respondents, all of them said that it was enjoyable and realistic. And some of the comments came out with the length of the simulation was the most crucial factor to aid their learning, but it also increased their confidence, gave them a more realistic view of managing an acutely unwell patient. It allowed them to prioritise and work in real time, and it allowed them to communicate with the patient throughout. But there were drawbacks to this. There was inconsistencies with the role players, and also with the signs and symptoms that they portrayed. So we've addressed that this year with having a little session for the role players, and going through kind of what's expected of them, what information they can expect beforehand, and that some moulage will be required during the scenario. So basically, overall, the long simulation session was successful in preparing the students for commencing Foundation Year 1. It boosted their confidence and allowed them to prioritise and work in real time with real people. Thank you.